Yeah. Thank you very much. I will be speaking on expanding neurosurgical training uh, and research in Ethiopia and neighboring countries. I have no disclosures, and to say a little bit about Ethiopia. Ethiopia is a country which is found at the Horn of Africa, and it's known as an origin of coffee and also known for its long distance runners, and also Ethiopia is a source of Blue Nile. So when we see the history of neurosurgery in Ethiopia, it's strongly associated with collaborations, and this is a picture which was taken in 1972 on the first Pan-African Association of Neurological Sciences meeting in Nairobi, and Ethiopia was represented by neurosurgeon, a Cuban neurosurgeon who was practicing there in Ethiopia by then. And then in the beginning of the 1990s, the Association of Neurological Sciences in Ethiopia was established with a collaboration of all professionals working on neurological sciences. And then the first neurosurgeons came back after their training from the UK, Bristol, and also from Cuba, Dr. Tadios and Dr. Zanaba, and then they started practicing neurosurgery in one of the biggest teaching hospitals, that's Black Lion Hospital, and they had a very good support by the Department of Surgery, and surgical residents were supporting them in assisting their elective and emergency neurosurgical procedures. And Dr. Tadios and Dr. Zanaba were really eager to start a training program, and then they reached out the FINS group in 1998, seeking for a collaboration and also some instruments and training assistance from the US. And then after a big effort, the neurosurgical training program in Ethiopia was started in 2008 with a collaboration of the Addis Ababa University, the University of Bergen, College of Surgeons of Eastern and Central Africa, and the FINS. And this training program became a reality with a relentless support of individuals from the University of Bergen, Professor Knut, Professor Morten, Ruby, and Erling, and also from the FINS group, John Clark, Merwin Began, Stephen Friedberg, Key Park, Timur Banerjee, Dr. Woodrow, and Andrew Kaufman. And the first training centers were Black Lion Hospital and the Myeong-sung Korean Hospital, and then two more centers were enrolled in the training program, the Alert Trauma Center and Zoditu Memorial Hospital. And then the curriculum was adopted from the COSEXA, and this was after a site visit from the COSEXA delegates. And two of the first centers were approved as neurosurgical training programs. And the training typically is a 5-year training, 1 year general surgery training, and 4 years of neurosurgery with attachments at different departments with an exchange program with Norway. And when we see the current status, it has now 2 more training programs in Addis, St. Paul's training program, and in the northern part of Ethiopia in Tigray, and now 16 cities have neurosurgical services with a dramatic increase in the access of neurosurgical services. And when we see the neurosurgical human workforce have exponentially improved, and this has really improved the access to neurosurgical services. And also the complexity of surgeries have improved. And one of the milestones is the start of micro surgery and skull-based surgery after a generous donation of a modern microscope from the Norwegian team. And we are able to start skull-based surgeries and other vascular surgeries in the hospitals in the capital, and also now starting to expand in other centers in Ethiopia. So when we see the research activities, it has exponentially increased, and one of the peculiar features is that most of the work recently is internal work and followed by collaborations with our partners outside of Ethiopia. So, and when you see like types of research activities that are done, it's mainly pediatrics, neurosurgery, and neurotrauma. And when you see the South-to-South collaborations, we have now trainees from South Sudan, Somalia, and also Uganda and Malawi, which is really beneficial for our training centers. And the Ethiopia-South Sudan collaboration has made possible by the sponsorship of the Ministry of Health of Ethiopia, which is really a great collaboration. And with Global Neurosurgery Committee, we have also ongoing plans to support and build the neurosurgical practice in South Sudan with the help of Dr. Winnie. And then the other is the Ethiopia-Rwanda Neurosurgery collaboration, which is made possible also with the help of the Ministries of Health of Rwanda and also Ethiopia. So we have currently at our training centers, we have 2 residents and also other residents in other training programs. And this is also a very good example of collaboration between the 2 countries. And there is also this triangular collaboration where we have South-to-South collaboration on top of the North collaboration, where we work together with our Malawian colleagues with the help of our Norwegian colleagues. So this is a really good example to ensure sustainability between the regions in our setting. So this is made possible with the collaboration of Addis Ababa University, Kamuzu University of Health Sciences, and Lilongwe Institute of Orthopedics. And we also have South-to-South research collaborations whereby we publish research papers on common case loads in our setup. So the benefits of South-to-South collaborations is that it's a similar setting and it's cost effective and it's sustainable and convenient. So the things to consider is we have to consider demands of the settings, understand the needs of the settings and standardize practice.